You are an FI1 in your first rotation during autumn. You attend a teaching session and are reminded that you should get a flu vaccination from occupational health or a number of drop-in clinics. You feel that you do not need the flu vaccine for your own protection as you are fit and well and have heard that it can make you feel unwell. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Do not have the flu jab and keep it quiet from your colleagues. B. Have the flu jab as soon as is convenient. It is important to protect your patients. C. Opt to have the flu jab before the weekend so that, if you feel unwell, you can recover at home. D. Tell everyone that you have already had the flu jab but actually never have it. E. Write a letter to the Chief Executive Officer of your hospital informing them of your right to opt out. Answer B, C, A, D. It is one of the General Medical Council's, GMC, recommendations that you should protect your patients, your colleagues, and yourself by being immunized against common serious communicable diseases where vaccines are available. To decide against this advice would leave you open to criticism from the GMC and colleagues. The best options are those that involve you having the flu jab, options B and C. The flu jab does not give you influenza but can cause low-grade temperatures and aching muscles for a few days. This should not be significant enough for you to take time off work, but you should not have to sacrifice your weekend to be unwell. Option B is therefore better than option C. The rest of the responses involve not having the flu jab, so they are not ideal. Option E is the best of those, since you are being proactive about what you believe. Also, contacting the management of the hospital will raise awareness that staff members may not agree with or understand the reasons behind staff vaccination, which could alert them to the need to address this issue. Option A is the next best response, in which you refuse the vaccination but are not untruthful about it, as in option D. You decided to take a year out of medicine between medical school and FI1. When you return to the wards, you feel out of practice in many of the skills and procedures you are required to carry out on a daily basis, such as venipuncture, arterial blood gases, and catheterization. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Ask your colleagues to teach you and watch you do a few of each procedure before you do them alone. B. Attempt the procedures anyway. You used to know how to do it. C. Avoid these procedures and ask your colleagues to perform them instead. D. Discuss retraining opportunities with your educational supervisor. E. Revise the skills in the medical education department using your old medical school notes to refamiliarize yourself. Answer D, A, E, B, C. Medical careers are varied, and when rotating from job to job, you will need to be able to pick up new skills and recall old ones quickly. You will frequently find that you have forgotten how to do some things well, and in these circumstances, you need to take responsibility for your own learning and become competent again quickly. The best way to get help is to discuss retraining opportunities with your educational supervisor, D. By doing this, you can set goals and they will be able to support you in reaching them. The next best response is option A. Your colleagues who practice these skills every day are excellent people to learn from, and it is in their best interests that you learn them well so that the work can be shared. Revising the procedure privately will help you, E. But learning face-to-face is much more effective when working on practical procedures than trying to remember it yourself by simulation. Option B is a fair response as you have learnt these procedures and performed them in the past. So, with sensible awareness of your limitations, having a go at a minor procedure such as cannulation is good for your learning. Option C is irresponsible and misses out on a vital learning opportunity as well as burdening your colleagues, so it is the most inappropriate response.